Hi, I'm Dr. BOTOX from the Real Housewives of Dublin, and I'm also the TV host on UK Botched called 50 Plastic Surgery Shockers. Here's 5 things that I wouldn't do as Dr. BOTOX from the Real Housewives of Dublin. First of all, I would never get Radiesse injected into my lips. I'll tell you why. Radiesse is calcium hydroxide. It's a great product to have injected along your jawline because it'll bond and bind with bone. It's a great product to have, you know, if you have a chin that's pulled back, a retronachal chin, it's a great product to have there because again, it'll build it up and it'll last forever. So it's a fabulous product. Calcium hydroxide, it likes to bond and bind and embed with bone. It doesn't want to go in your lips. Believe me, no Radiesse in your lips. The next thing, number 2, is do not have filler in the tip of your nose. If you have filler in the tip of your nose, it can occlude and block the vessels, and it can actually, the tip of your nose can actually turn black. So that is not a good thing to happen. Number three is if you have a gummy smile, don't get gum surgery. Periodontists will tell you change all the gums. You know when people smile and their mouth goes up and it shows loads of gum? Honestly, $300 each side and 3 units of Botox here, 3 units of Botox here, and it'll stop the elevator muscle here pulling up the jaw, and again, it'll just hide. So you don't need jaw surgery. Number 4, to slug or not to slug. Everyone's going to come at me. I keep bringing this up, but I'm really passionate about this. I don't think you should slug because I think there's a number of reasons. 1, it changes the pH of your expensive skin products. Number 2, it certainly isn't. I'm telling you now, if you have my hyaluronic 1000X serum or if you have my triple peptide eye cream, this is not compatible. This affects the stability of this. This affects the stability of my 1000X hyaluronic. It's going to change the pH of your products also. It can also cause irritation. Slugging can also cause the pores to become blocked, and it actually can cause acne. So it's insane to me, to be quite honest. And lastly, stop using these face rollers. They're 0.2 or 0.3 or 0.5, and people roll them in their face and they put them away, then they put them back on. They're just rolling bacteria. They can cause bleeding because some of them can be quite deep. They come to 1 millimeter. So don't use these. You're not allowed. Stop. Bad for you. And again, anytime you break the surface of the skin, you need to have someone who's been to medical school, dental school, everything school for 5 or 6 years and understands. You know, I am weird about tattoos. I would like to get a tattoo. I'm not getting a tattoo unless a doctor or a dentist is doing it because it needs to be someone who actually understands and has had nurses shouting at them for 6 years about cross-infection control. And I would love a tattoo, but I have never found a doctor who does tattoos. So until that time comes, I'm not getting a tattoo for that reason. People breaking the skin barrier, you have to understand there's high risk of cross-infection. I get myself worked up.